Thing to kind of log on though. So how do we call you Dr. Cobb? How do I address you, my friend?
Ben.
Brother, okay.
Yeah. Ben is just fine. Let me see. I can even. Is there a way where I can change my name on here?
Yeah, if you log out, just click leave. Yeah, you come back in. Roundup fam. What's going down, Roundup fam? I'm honored to serve. I'm here to serve you. Today I've got a doctor with us today. Man, I'm just so honored that finally got a doctor that would be willing to come on and give us some content. Give us some content. You would not believe how hard it is for me to find people that are willing to come on here and speak. Not only speak, but to share what they know. This brother here is super sharp. This brother is just sharp. If I can get him back on here. Here we go. Brother Ben?
Yes.
Got you back. Okay. Roundup, give me a few more seconds. We're going to get rocking and rolling here.
Okay.
Got your kids pick. Greetings from our Roundup family. Greetings. Oh, boy. Greetings, class. This is Chris Haskins with the realestateroundup.com. My mission and my ministry is to raise your financial literacy through real estate investing and entrepreneurship. And doing that today, I get to hang out with some unbelievable people. Usually we're talking about business, which I just found out this gentleman here is actually a businessman too. He owns real estate also. I'm just very excited to know that. Dr. Ben Cobb, good morning, my friend.
Good morning.
Good to see you. How's the weather up there in Pennsylvania?
Cold. We had a few days where it was warm outside, and the weatherman tried to play a trick on us, and they brought it right back. We got this cold front in, so it's rainy. It's about 37 degrees and it's raining. You can't really see outside, but it's coming down pretty strong.
Oh my Lord, you can keep that. Roundup, the reason I wanted a doctor, an MD, to come on, because I feel that it is pertinent for us to understand our health, what's going on in the environment, the uncertainty, the fear that's going on in our economy. Literally 10 minutes before I logged on here with the doctor, they announced that the schools in Virginia will be closed for the remaining of the year. I have no idea. I don't watch the news, but so I divert to my experts. And Benjamin Cobb actually is an anesthesiology trained physician who was born in Washington, D.C., grew up in Virginia, graduated from my alum, Hampton University, with BS in Analytical Chemistry. Also attended the University of Pittsburgh School of Medicine and served as his class vice president at Pitt. And now he's doing some amazing things in the medical field. So, Doc, thank you for joining us today, my friend.
Thanks for having me. Thank you so much.
Yep. So just give us a little, if you want to stay there for a second, about your background, and then we'll move into this whole Corona thing and just share what we can about this coronavirus, Brother Ben.
Okay, so yeah, I am originally from Virginia, from the Fredericksburg area. I did my undergrad at Hampton University, like you said, in Analytical Chemistry. And then after that, I went to University of Pittsburgh School of Medicine, where I got my medical degree. And then I did my residency training in Philadelphia at the University of Pennsylvania. After completing my anesthesiology and critical care training, I stayed at the University of Pennsylvania to do additional training or additional fellowship in high-risk obstetric anesthesia. And this field is really designed to take care of pregnant women that are sicker than most pregnant women, to get them through the perioperative experience so that they can deliver babies safely and healthfully. I also got a master's in health policy through the National Clinician Scholars Program. It's a similar program to the previous Robert Wood Johnson Clinical Scholars Program, but the name has been changed and the curriculum has been rebranded. Some of the same teaching content and curriculum is still available. This program really focuses on teaching health equity, health policy research, understanding the current climate of healthcare in this country and how patients access it and how we deliver it.
Wow. That's going to be so, I guess, so pertinent as we go here and beyond, if it wasn't before, how we interact. Doc, what are you seeing? I mean, you're in the hospitals all the time now. As we're just embracing this corona thing, what are you seeing that when you're going in?
So I'll break it down what I'm seeing from three different views.
Yeah.
One is going to be the patient view. Okay. The second is going to be the provider view. Okay. And the third will be the administration view.
Okay.
Because seeing it through the different lenses of these different categories of people, I think really frames how everyone views what's going on and the problems that we're facing in this pandemic.
Gotcha.
So from the patient's views, they're terrified. They're terrified. Particularly, you ready for this?
Mm-hmm.
Minority patients.
Okay.
So imagine you have Black patients, Hispanic patients, okay, patients that are generally underserved within medicine. They're already afraid of coming to the hospital because of years of what has happened with our people in terms of the CDC and other groups practicing and experimenting medicine on us, such as the Tuskegee syphilis trials. So they're already afraid of coming into the hospital for that reason. Okay, and this is years.
This is a true fear. I mean, this is when you say fear, I'm thinking that that's not real, but that's a legitimate fear, I would think.
Oh, absolutely. The doctor prescribed this medication for me. Is it really the best thing for me? Does the doctor have my best interest at heart?
Unbelievable.
Would he prescribe this for me if I weren't a minority? So you have that as the foundation, or that's the baseline. Now you throw this coronavirus on top of it. They're already coming to a health institution or to a system that they're fearful in. And now they present and they're wondering how they're going to be treated and how they're going to be diagnosed and managed in light of all this that's going on in the current climate.
Wow.
Okay. So the patients are fearful. They're scared. They're coming to the hospital to visit their loved ones. They're coming into the hospital to see their friends. And they're terrified. Am I going to get coronavirus?
Wow.
They know that they may or may not have adequate insurance. So why would they want to come to the hospital to visit their friends and family if they have poor insurance and they get sick? Who's going to treat them? Who's going to take care of them? Are they going to get the top-notch medical treatment? Okay. Second, also for the patients that are coming in, what does it mean if they are healthy and they're coming in to have something else done? You know, most hospitals, one of the recommendations from the Surgeon General was who's also an anesthesiologist, which is really nice because he understands the perioperative medicine and what it all entails. It's really, what does it mean to do an elective surgery? Now, typically we say, you know, there's 3 classifications of surgeries. Emergent surgeries that have to go right now. You cannot wait for it. These are things like if your aorta, which is the major blood vessel that comes out of your heart to pump blood to the rest of your body, if that ruptures, that's an emergency. You can't wait. You got to go now. Okay. If you need an emergent C-section because a woman is bleeding from her vagina, that's an emergent procedure. You got to go now. The second category is urgent procedures. Generally, we say these are procedures that have to be done within a day. It may not have to go right now, but it usually should happen within a day. This could be like an infected gallbladder or an infected appendix. Okay. Now, other surgeries, the third category, we say elective surgeries. These are things that you can do over 24 hours and it's not going to change the patient's outcome. A breast reduction, liposuction, maybe, I don't know, a colonoscopy, things like that.
Gotcha.
We've canceled, or we're trying to cancel all of these elective procedures to minimize the risk of patients coming to the hospital and transmitting the illness to one another and the hospital staff. So that's the one thing that the hospital has done to try to curtail and, you know, minimize some of this risk.
Yeah.
The urgent and the emergent procedures we're still doing because those have to go. They can't wait.
Now I'm thinking about my wife. Oh, I'm sorry. Go ahead.
And this is really starting to affect patients, and patients are knowing this. It's inconvenient. You can imagine if you've had this procedure scheduled and you've taken time off work and you've arranged for your in-laws or your family members to watch your children for you, and you have someone to come watch the dog for you, and you have someone to grow. I mean, it takes a lot of coordination, and now this coronavirus hits and all that's changed. Okay. And then the second and third categories are the lenses from the healthcare professionals like myself, and then third, the administration. I didn't mean to cut you off. I'm gonna let you go because I'll talk for days. I'll talk your head off.
Well, I'm thinking about my wife. We don't know when our son is coming. Obviously, she turns from, I guess, urgent to right now. I mean, there is no waiting for that. When it happens, it happens. We
Correct.
have to kind of make a decision to go in right at that time. I guess that adds to our fear per se.
Mm-hmm.
So you're saying the professional from your aspect?
From our aspect, there's also fear. So, as medical professionals, I like to think of us as the front lines or the Marines. We're in the trenches. We're the ones actually carrying out, doing the work. And it's not all of us, but depending on the way that you practice medicine and the way that you take care of patients, you can be right up and close and personal, or you can be very distanced, like the pathologist that's looking at blood smears or the radiologist that's reading CAT scans. They may not be face to face with patients, but surgeons, anesthesia providers, primary care physicians, pediatricians that interface with patients at close ranges and close distances, it's scary for us. There's a shortage of personal protective equipment, which you guys have heard probably in the news as PPE. There's a shortage of these things that we need to be able to do our job safely.
So you guys are nervous about contracting it from the people that are coming in? Is that what you're saying?
Absolutely. Absolutely. If you come into the hospital with a cough, then you can easily transmit it to a nurse. The nurse runs into, the nurse, she may be on the floor, an inpatient, taking care of people with coughs or pneumonias. And then I run into that nurse in the cafeteria while I'm trying to get lunch. Now I contract it. You see?
Yes. Wow. I had never thought about that.
A lot of the hospitals are short of masks. We're short of hoods, face shields. Okay. We're short of gloves. Mm-hmm. And we're not only short of it because we don't order enough for healthcare providers, but you ready for this? Patients and their family members are coming into the hospital and stealing them because they can't find them out in the community.
Oh my Lord.
So you go to Home Depot, you can't find a mask. You go to Lowe's, you can't find a mask. Oh, there's masks in the hospital. So you come into the hospital and you take the hospital mask.
Wow.
Now I show up to do work and there's masks that are unavailable. Wow. That causes a problem.
Okay. And the third one from the provider's aspect?
From the administration standpoint, okay? So we cover the patients, we cover the providers. Providers are really the physicians, the nurses, nurse practitioners, the physician assistants, the CNAs, the orderlies, all those types of people. And the last is really from the administration. In the administration, these are the people that are leading the hospital, leading the different committees of the hospital from the top all the way down to the bottom. And, these people have a very unique role because a lot of them are not actually doing patient care, okay? They're not the ones that are interfacing with patients, but they're the ones that have to make the decision of how we practice so that we can practice. And they're really put in a tough situation because the hospital has to stay open. We don't have the luxury of closing like your Olive Garden or your Red Lobster. We have a responsibility to take care of patients. So we have to keep the doors open, but you have to be able to protect your staff so that your staff doesn't get sick. Because if you get all of your doctors and nurses sick, who's going to take care of them?
Wow.
If your hospital has a history of getting the provider sick, do you think anyone's going to sign up and say, hey, send me over there, I'll take a job there, now that 10 or 20% of your doctors are out sick?
Wow.
So the administration, they're in a tough situation to follow, the national guidelines from the Center for Disease Control, as well as our Surgeon General, but they also got to make sure they stay in the black and keep the doors open to provide for patients. So everyone is looking through a different lens, and it reminds me of, I remember back in grade school when we were talking about perspective. One of my teachers, I forget what grade I'm in, she told a story of 8 different people looking at an elephant, and describing what they saw. And one person looked at the foot, one person looked at the hooves, one person looked at the trunk, the tail, one person sat on top. And they all had a different perspective and described something, but really they were all correct. They were just all looking at the elephant from a different angle. And that's what we're seeing in healthcare right now.
Interesting. I had never even thought about it. I'm an admin guy. I never thought about the decisions they have to make. You have to stay open. You don't want everybody to get sick, the one that's providing the work. That's a tough decision right there, brother.
And you got to protect your personnel, but you don't have the proper equipment to protect your personnel. So what do? How can you figure out a way to protect the people? But, I made the analogy. It'd be like sending your soldiers off to war with, they're supposed to have missile launchers and mortars and firearms, and you send them with just knives.
Round
up
if you just
knives.
If you're just joining us, thank you. I'm here with Dr. Benjamin Cobb. We're just talking about the coronavirus and his opinion on it. He's a medical doctor in Philadelphia. Are you in the inner city working, Doc?
I am. Yeah.
I bet you got some stories, bro.
Man.
So let me ask you, how long are you thinking that this thing is going to last? Do you have any opinion on that?
It's really hard to say. Generally, if I make a blanket statement about respiratory illnesses, usually respiratory illnesses go away in the late spring and the early summertime.
Generally speaking.
Generally speaking, you don't really see people contracting the flu in the summertime. The weather's warmer. More and more people are outside. You don't have as many people with depressed and weakened immune systems. Okay, yeah. So generally, we see these things go away in the late spring and the early summer, and they kind of pick back up in like the fall, and that's when the flu. And we time it that way so that the flu vaccine comes out in somewhere around like the early fall, late summer, so you can start giving people prophylactic treatment to cover them through the wintertime. With this virus, it's hard to say, and I think it's hard to say because the rate that it's spreading is so great, and other places that generally have warmer weather than we have now, people are still getting infected. So you look at places like the Middle East. The Middle East, they don't get weather that's 30 and 20 degrees like we get, So generally the flu doesn't hit them as hard. Mm-hmm. But this coronavirus is hitting the Middle East that's having weather in like the low 70s, the high 60s right now, and people are still getting it.
Okay.
So, I'm not a virologist. I don't practice infectious disease, but just me thinking through it, I can't imagine that this is going to be something that's going to go away when the weather gets warmer.
Okay. So
I know Donald Trump said July, August, and I don't know where that came from. If that was just 2 months he picked, off the top of his head, because that's right after the second quarter. That's the beginning of the third quarter. Maybe that's why he picked those months. I don't know. But
so right now it's a question mark is what you're telling me.
It's a question mark. Nobody knows. Nobody, and it's hard to say. The treatment that we have for it is experimental. We're using an antibac. If you go to the hospital right now with a community-acquired pneumonia, okay, and we give you a Z-Pack, I'm sure you've probably had a Z-Pack before. You take the 2 pills on one day, and then you take the other pills on another day. That drug is called azithromycin. That's for treating bacteria. We're giving people a drug to treat bacteria right now, to treat this virus, hoping that it does something, okay? We're also using a drug that we usually use to treat malaria as an anti-malaria drug, as well as a drug to treat like lupus and other autoimmune disorders. We're throwing that at it also. We don't have a clue what we're doing. We're just trying things. And that's what's scary. That is what's scary.
So who should be, Doc, the most concerned? I feel like I just flew to Dallas last week. Mm-hmm. The plane was empty, had a private jet. Nobody on the plane, nobody in the airport, nobody in the rental car. My hotel had 10 people in it, Doc. Who should be concerned? Who's the most at risk here?
I'm gonna break that down into two parts. All right. When you say who's at risk,
Most risk, I would say. Most risk.
who's at most risk from a health standpoint, or who's at most risk from a financial standpoint?
Let's do both, brother. Let's do them both.
From a healthcare standpoint, okay? From a healthcare standpoint, the people that are most at risk are older people, okay? Older people at most risk because as the older you get, your lung function decreases. So that puts you at risk, okay? All of us know, the people that are 80, 90-year-old in church that sound like they have that death rattle. They're too weak to bring up their secretions. They cough and you just hear that rattle and just stays there,
Okay.
The people that, as their lung function is decreasing.
Mm-hmm.
So those people are at risk. Anybody that's immunosuppressed, okay? So cancer patients that have autoimmune disease, patients that are taking steroids to suppress their body, okay? Patients that have sickle cell disease, particularly like in our African and African-American population.
Mm-hmm.
People that are older, people that have other concomitant illnesses, high blood pressure, diabetes, high cholesterol, stroke, heart disease, okay? Other lung and respiratory diseases. These are people that are most at risk. Younger people generally can fight off an infection because we have a stronger immune system, better lung function, and we don't have the other diseases and illnesses on top of it that kind of work in synergy to just pull you down. You can imagine if you take someone that's 20 or 30 and they lay in the bed for a month, they can probably get up and, still be able to be functional. But imagine if you take someone 80 years old that already has a bad back with arthritis, bad hips, bad knees, and they stay in a bed or in a hospital bed for a month trying to recover from that, and then they get discharged to a nursing home. These are the people that are going to be the most at risk. Okay? From a financial standpoint, the people that are going to be most at risk are the lower socioeconomic populations. And the reason I think they're going to be the most at risk is because, this thing is terrifying everybody. Every single financial market across the world has taken a major hit because of this. Okay. If you pick up a random product in your household, even the clothes on your back, 9 times out of 10, it's going to say what?
Made in China.
Made in China. And if you the other 10% that says made in Bangladesh or made in India, the materials that they're getting to make those things are probably coming from China.
Somewhere on the food.
Somewhere those products are coming from China, whether directly or indirectly, they're coming from China. So it's affecting every single market across the country. Okay. So all these small businesses that, we're seeing on CNN and MSNBC that they're talking about giving the bailout to, okay, those small businesses are suffering. And the people that are working at these jobs are going to be laid off. And once they're laid off, a good thing would be if they get mortgage relief. See, there's systems in place to protect them so that they don't foreclose on their home because they can't pay their mortgage. But what if they don't have a mortgage? What if you have a rent? What if you're a tenant and your tenant decides they're not going to pay because they don't have it? Is there anything? Is there anything in place to protect them?
There's
particularly up here in Philadelphia. I think the number was, I forget how many it was. It was an astronomically high number. The children that rely on going to school to get free breakfast and free lunch because they don't have those meals at home. And now the school is shut down. What's going to happen to those children getting those meals?
Good Lord, man.
So the lower socioeconomic population are going to be at risk from a financial standpoint. The CEO of JP Morgan, Jamie Dimon, he's going to be fine. If he never works another day in his life, he's going to be fine. It's really the people who are living check to check, like most Americans, that are out of employment. Those are the people that are going to be most affected.
Well, a lot of those people, frankly, are our tenants. Well, I can speak for myself. They are the tenants that we deal with. They don't have mortgages because they do lease options from us. Even with I'm just thinking about the food service community. Doc, what in the world are they doing? I mean, how are they going to make it by? No restaurants have been open for weeks.
I know. Yesterday I saw a commercial on TV for DoorDash, and they were saying how the workers in these restaurants supported us for many years. We should not turn our backs on them. They're practicing safe hand hygiene, clean practices to minimize the transmission of food, and we should continue to rely on them so that we can allow them to have funds to continue living. But it's a ghost town. Like,
how does it look up there? Yeah, tell me how it looks in Philly. I mean, you in the Philly is just jumping.
It's a ghost town. It's 1.6 million people in the city, and it makes it almost impossible to leave your home and maintain a 6-foot radius around yourself for people to not touch you. It makes it almost like it's. I mean, how do you imagine? We're not as big as New York City has probably somewhere around 8.5 million.
Yeah.
But New York City is much bigger land-wise than Philadelphia. But just imagine being in New York City. Like the other day, I got house sick, so I got in my car and I drive around the city, and I see people standing at the bus stop, and they're doing great. People have masks on at the bus stop, and they're all 6 feet from each other. But then the door opens on the bus, and guess what happens?
What?
They all get on the bus, and now they're sitting right beside each other. But there's a lot of people that live in the inner city that don't have vehicles, and that's their primary mode of transportation. Mm-hmm. So what are you going to do? You got to go to the drugstore to get your high blood pressure medication, your anti-seizure medication. You have to go to the market to be able to get groceries, Well,
let me ask you, let me stay here in that framework for a second. What are you going to give us, Doc, to recommend? What can you give us to say, listen, this thing is here. It's going to be here for a while. What type of advice were you going to give my Roundup family to just make sure we contain our family and stay healthy?
I mean, the first thing I would say is it's going to be a financial tip, because if it doesn't make money, it doesn't make sense.
Okay.
I think people should re-sit down at the table and re-strategize and think of their household budget. The things that are essential, stay. The things that are non-essential, got to go. Okay? And the reason I say that is because none of us know when the next paycheck is going to come.
We don't. Even rents. I don't even know when the rent's coming in. I mean, I just haven't.
Nobody knows. I mean, if you guys have been following what's going on with Boeing, Boeing is the second largest defense contractor in this country. And their stock price has dropped almost 80%. They're talking about being part of the $1 trillion bailout that was originally designed for the airline industry to go to Boeing. Now, granted, part of it is because of their 737 MAX, those 2 airplane accidents that they had. But a lot of it also is that people are canceling the orders because they're not going to be flying planes with this coronavirus and using helicopters.
Yeah.
So I think none of us have secure jobs. And to protect ourselves, I think we need to look at our budget and re-sit down and try to eliminate the things that are non-essential. Okay?
It's funny you say that, man. Coming from a doctor is talking about redo your budget, man. You're just a sharp guy, man. I had no idea that you were so deep as you were as we talked before we went live. But I'm surprised to hear you talk about finances first.
I mean, that's it.
It's real. No, it's
finances
true.
Is everything. Finances is the number one reason people get divorced. It's the number one reason that people, have problems in life. It all boils back. I'm not saying that, finances will make you happier or sad, but your financial situation is a direct multiplier of what you have going in life. If you naturally have a good life and you have good finances to go with it, you're going to do you'll be really, really happy. You'll be a pleasant life. If you're doing, moderately bad and you're broke, it's going to make you seem even worse. You're not going to be happy with money, but it definitely will act as a multiplier to your situation. So I think cash is king. I think people should stay with, liquid cash that they can quickly access, because who knows? If the bank's shut down and you can't access your funds, it doesn't matter if you have money in the bank. If you can't access it, who knows? If we get to a point where, credit transactions no longer hold up, cash should be king. So I think people should, redo their budget, remove the things that are non-essentials that they don't need in time of crises. 2, I think people should make sure they have access to liquid cash on hand that they can use things for. 3, I think now is the time to apply for additional lines of credit. The reason I say that is having additional lines of credit right now will allow people to have access to funds that they otherwise would not have access to. You know, if you take out another credit card that just sits there and you don't use it, you may be able to use it in the future for something. Who knows what's going to happen? It's better to have it and not need it than need it and not have it.
Okay? That is so deep. That's true.
The second thing I think people should do is establish contingency plans on what they're going to do if things really get chaotic regarding their health. Okay. You know, if you do come down with the coronavirus and you're unable to work, or you're unable to be the head person in your household, you're unable to be quote unquote big mama, you know, from Soul Food, the movie Soul Food, and hold things together, who's going to be the next person that understands how to do things and to keep the ship afloat? Oh man. You know, for me in my household, that's me, you know, so I have to sit down with my wife and say, honey, okay, look, you know, if I become ill in the hospital, here's access to my insurance policy. Okay. Here's my credit cards. Here's where I have some extra cash lying around. Okay. Here's the spare key to my car. These are the bills that I'm paying from these accounts. Okay. Because if I get sick and I have to go to the hospital, I need to know that my family and my 3 children are going to be okay. I need to know that, you know, she as the co-pilot will be able to keep things afloat until I get better and get back on my feet and come back to the household.
I need to do that myself, Doc. I'm glad you mentioned that.
It's like, you know, we see people scrounging around. Oh, now something happened. Where's the insurance policy? I don't know. The insurance company not going to call you up and say, hey, yeah, let me send you the check, you know, the insurance policy. No. You got to call them and jump through hoops. What's his social security number? What's the policy number? What's his address? Who's the beneficiary? What's their address? What's their date of birth? You're trying to scrounge around for all this stuff while the person, and generally the person is being able to take care of it, but they can't take care of it now because they're ill. Yeah. You see what I'm saying?
Wow. Thank you for that.
I don't think that it's going to get that bad, but we have to prepare for the worst and expect that the worst is never going to happen.
Prepare for the worst.
Mm-hmm. Okay. Third thing I think we should do in terms of health-wise, we have to do this social distancing. We have to try to minimize the chance of us getting the coronavirus. Right now, they're saying that the viral particles can reach out to 6 feet. Okay, so the recommendation is to keep people away from you 6 feet.
Do we need to be wearing these masks, Doc? I'm hearing conflicting stories. You know, not that I...
So if you have the appropriate mask, which is the N95, yes. Okay. The other masks that we have, the regular mask that you would get, that you see like, you know, the painters wearing, or the mask that you see people outside doing construction or cutting grass with, not it. The mask that you see the Asians and the nail salons wearing, not going to do it. That mask is designed to protect the other people from what you're giving them. It's not going to protect you. If you think about it, when you turn on TV and you see surgeries in the operating room, everybody in the operating room is wearing a mask except for the patient. The reason the patient is not wearing a mask is because the patient is not going to get sick from themselves. We're wearing a mask to prevent us from giving what we have to the patient.
Wow.
So if you're wearing a mask, that mask that you see people wearing is not going to protect you from getting the coronavirus. It's only going to protect you from sharing it, if you have it, sharing it with other people.
Gotcha.
Okay.
Are these masks available to my rounduppers? Where would we go to even get these, Doc?
So you used to be able to get them from Walmart, Target, Sherwin-Williams, Home Depot, Lowe's, those kind of stores. they're all sold out. Particularly in my neighborhood, they're all sold out. You go on Amazon, you may have found someone that hoarded a couple hundred boxes before. Now they're selling them for $50 a box. You may be able to find them, but they're all sold out. You can't find them. And because you can't find them, I believe that the guidelines from the CDC have been relaxed to say, oh, just wear a bandana. Well, if a bandana was sufficient, why do we have masks in the first place? Especially because a bandana will leave a lower carbon footprint. You don't have, a bandana is reusable. Everyone has their own bandana. You wash it and you keep using it. You don't have millions and millions of masks that people have been using for years that are one-time use where you're throwing them away.
I see.
If you're going to tell me that a bandana is equally as efficient, you see? But the bandana is not, but that's all we have. So we're telling people to use a bandana instead.
Gotcha. Is that going to prevent me from getting, if I wrap it around, is that going to help me, Doc?
No.
Let me do this real quick, Doc. 1 second, round up. 1 second, Doc. If you're just joining us, round up as we're going. I got to just make sure people know. I'm here with Dr. Benjamin Cobb. He's in Philadelphia, MD. We're just talking about surviving this quarantine from the government. The schools are shut down. Get your questions in, as I had questions for Doc too, just to ask him about what should we do just to maintain through this quarantine time. Go ahead, Doc. What were you saying?
I was going to say that I posted on Facebook. I said, if the mask is sufficient, why is it I can have like something like a rotten egg in the room, and I put a mask on my face, or I put a scarf on my face, I can still smell it. If I can smell it through the mask, viral particles can get through it.
I would presume that they're smaller.
They're smaller. So we don't have the appropriate equipment, and the appropriate equipment that we do have, we have it in limited quantities. And it's a problem. It's a big concern.
So social distancing, that's going to be is this the main thing that we need to be worried about here? Because when I'm going out, I'm seeing people with gloves, masks, people not wanting to touch nothing. I get nervous when I go to the grocery store, just opening up the doors, getting a frozen food out.
Right. I mean, I think people are doing what seems to be intuitive to them. They're trying to use their best judgment or use common sense. But, I don't see that. I don't see that helping much. If you're wearing gloves, if you're not touching your face, what are you wearing the gloves for?
Either way, right? I mean, it's the same effect if you're not touching your.
It's the same effect. Like the virus, it's not coming through your skin. It goes through your nose. It goes through your mouth. It can potentially go through your eyes. So, to me, that just doesn't make sense.
Gotcha.
What makes sense to me is to stay away from anyone that has it, minimizing your exposure. And by minimizing your exposure, you can make the argument that you're not going to get it. If you take someone and they're able to stay in their house for a year, they're not going to get it. They're not exposed to it. I mean, granted, it's impractical to be in your house for a year and never leave, but you have to use your best judgment that when you do leave the house to try to practice social distancing. If you live in an area where there is Instacart, my family, we started using Instacart. Do you guys have Instacart down there?
I've heard of it. My wife is all on the internet. Just bring me up to speed. What is it?
So basically you go on Instacart and you can look, you put in your zip code and it shows you all the grocery stores in your area that participate with Instacart. You select all the food that you want and they tell you a pickup time. And then you pull up into a designated spot in the front of the store and someone comes and loads all of your groceries in the trunk of your car and you pull off. You don't have to go in the car. You don't have to go in the store.
Gotcha. So are you recommending that, Doc?
I'm recommending it. I mean, that's the one place that we're all going to have to go is to the grocery store.
Yeah, we all have to end up.
It costs, up here, it costs $1.99 for the service. So, it costs you $2 to not have to go in the store and stand in front of a cashier who comes in contact with everybody, Wow. You don't have to pass people in the aisle who are coughing. You can just get all of your groceries bagged up and have someone drop them in your car and you can pull off. I think that's a way to help to minimize it. It's just all these little things together may not be the silver bullet, but I think together the synergy will help decrease your chances of getting it.
So if someone, for instance, Doc, then we'll get to some Q&A rounduppers. Make sure you get your questions in here for Dr. Cobb. I think I'm someone that says, you know what, I'm not feeling well. Can you speak on someone that may think that they've been infected? Mm-hmm. What should they do, Doc? Or should they rush to the hospital, call their regular doctor? What do we do?
So I think the best thing to do is one, you should, if you really think that you have it, you should self-quarantine yourself.
Is it going to be a lung? Is it going to be a lung thing, not a breathing?
So it affects people can get it differently. They're saying if you have a fever, okay, shortness of breath, okay, or difficulty breathing, chest pain, okay, myalgias or body aches, like your body just feels achy, okay. Those are like the main things. Or if you're a healthcare worker, those are kind of like the main things that they're thinking that would put you at a higher risk of having it, or more likely that you do have it.
Gotcha.
They just approved the rapid test. So the rapid test,
what's that?
You basically go and you take the test and they tell you your results in 45 minutes, whether you have the coronavirus or not. Okay. The current test, I don't think we have the rapid test out everywhere just yet, because it just got approved by the FDA either last night or this morning. It was within the last 48 hours. Previously, they were doing the culture. You drive to a location. Where I am, they basically put up like maybe 8 tents where the Eagle in the stadium where the Phillies play. So, down the Phillies, the Eagles, and the Sixers all play in the sports complex, and they put up tents. And you drive to the tent, they swab your nose, they give you a hotline to call, and they say your results are available in 5 to 7 days.
Gotcha.
2 problems I have with that. 1, 5 to 7 days is too long, because within that 5 to 7 days, if you don't think that you have it, you're still moving around, still spreading it. You don't know that you have it or not. Okay. The second thing is there's a shortage of the tests. So not only do we not have enough tests to test everybody, okay, the time to get your result is too long. So I think that if you really think that you have it, probably the best thing to do is go to a location and get tested.
Get tested first.
Get tested, because you may be asymptomatic. You could start with just a cough or just a tickle, something that feels like a normal cold that you would have, where you normally go and treat it with Robitussin or Dimetapp or daytime, nighttime, or NyQuil, or whatever you normally treat your common cold with. Mm-hmm. Okay. And then once you get tested, it'll give you the opportunity to think about what the next step is going to be. Whether your employer is going to provide you with some form of short-term disability until your results come back and says that you're clear. Okay. Whether you're going to quarantine yourself to the basement and have your family on the upper levels. Okay. Whether you're going to check into a hotel. It really gives you an option to know, what's the best thing to do.
So if we are positive, we need to just basically stay away. We need to take action on our own to stay away from people. Is that what you're saying?
Absolutely. Because if you're healthy and you don't have other medical problems, okay, the chance of you truly dying from coronavirus is low. The problem is if you give it to your parents,
Gotcha.
You give it to your grandparents,
mm-hmm.
Okay, you give it to your children. Right now, they're saying that children are not affected by it. I don't believe that. I think we're just not testing children. Children have so many coughs, colds, ear infections, sniffles. Children are always sick. My 8-month-old has been sick for probably like the last 3 months. He gets better for 2 days, and he picks something right up again at daycare.
It's just
they're always congested. Everything goes in their mouth. They touch everything. They're a nidus for infection.
Yeah.
So I think that you really have to decide what's going to be the next step and how you're going to protect yourself from spreading it to your other friends and family.
Gotcha. My last question, Doc, was what do you see changing Hold up, before we move there, getting treatment. I mean, I'm presuming that the hospitals are just. I mean, you're in them more than me, obviously. Is it just an overwhelming amount of people that are coming? Is it slower at the hospitals?
The hospitals are slower.
Okay, they are slower. All right.
They're slower. And they're slower, particularly with what I do, like I said, because, most hospitals are suspending doing elective procedures.
Gotcha.
Most of the surgeries that we perform in this country are elective procedures. They're not urgent or emergent surgeries. Okay.
Okay.
So, your surgery centers where you're going to have hand surgery or where you're going to have back surgery, all those things, we're not doing as many of those. So hospitals from an operating room and a surgical standpoint volume has decreased a lot.
Gotcha.
Okay. Again, going back to that first comment that I made, patients are afraid of coming to the hospital, afraid that they're going to get it.
Yeah, I would think that.
I think there are more people that are staying at home, self-treating themselves for fear of coming into the hospital and getting it and be worse off than they were before they came in.
Oh my Lord.
Generally you have high blood pressure and you start getting a headache and you say, oh, I know my blood pressure is acting out. Let me just go into the hospital and get tuned up. You say, no. I'll just take an extra blood pressure pill at home. I'll decrease my salt intake. I'm not going to go to the hospital because I don't want to get that Rona. That's what people are saying.
Yeah. Are you serious? That's something, Doc. I never thought about this stuff, man. I mean, you're just opening up my eyes to so many different scenarios, people that have different conditions. What do you see changing with this pandemic, Doc, regarding how we react to things? I mean, I guess our interaction with people, being prepared, because I'm just foreseeing, like, we have, obviously, I told you we're pregnant. My wife, they already said, I'm the only person that can come. No one else can come to the hospital.
Right.
They only have one doctor on call. I'm nervous. We don't know what, obviously the baby doesn't have a time when he wants to come. I'm like, what do you see changing in the future, the way we handle this stuff, Doc?
I think it's going to get really, really bad. I think it's going to get really bad. Speaking particularly to labor and delivery, there's petitions going around now to allow family members in the room. Like you said, there's a hospital up here that said only the mother can be in the room.
Okay,
Nobody, just the mother.
Man, that's rough.
It's really going to change the way that we do things. It's going to, people are losing jobs because businesses are closing. Okay. People's financial situation can really change.
I see.
The healthcare that people normally would get, people are not going to be getting because they're afraid of going to the hospital where people have the coronavirus. And I predict that it's only going to get worse because the economy is going to get worse.
Yeah.
And remember what I told you about money earlier. Money is a multiplier of the situation. So if the coronavirus itself is already doing things to the population on a global level, you throw up a jacked up economy on top of that, man, it's going to multiply just how bad the coronavirus really seems.
Yeah. Well, thank you so much, Doc, for joining us. I'm gonna get to some Q&A roundup. Get your questions in for Dr. Benjamin Cobb. Thank you so much for your time.
Thanks for having me. I'm glad to be able to talk with you guys today.
Yeah, man, because I don't watch the news. I'm like, I want to hear right from the people that are in the field, on the front line doing this. Crystal saying, thank you so much, for you, Dr. Cobb, and the nurses and all the healthcare staff that you do.
Thank you for your support, Crystal.
Yeah. Round up, get your questions in down here. Curtis, my boy, Curtis, another Hampton University graduate. How do you naturally fight a virus? Are there any home remedies that would be effective, Dr. Cobb?
Yeah, so I think so naturally fighting a virus, it depends. It really depends on what type of virus we're talking about. If you have the HIV virus, there's nothing naturally you can do to fight that. Respiratory virus, generally your body will get over it. Your body can fight it and you can get better. Presuming that you have an intact immune system and you're not immunosuppressed and you don't have other chronic comorbid conditions. Home remedies that you can do, or anything that makes the symptoms feel better. So if you have a virus and you have a headache, take Tylenol. If you have a sore throat, cough drops, lemon tea. If you're trying to use something to suppress your cough, honey will suppress a cough. You should not give honey to children, to babies. I think it's under the age of 1. I believe it's under. So if you give honey to babies under the age of 1, they can get Clostridium infection, which can cause them to have like muscle weakness and things like that. Gotcha. So they recommend not giving it to children under 1. I believe it's under 1. I'm not familiar with the current guidelines, but you guys can look at if you Google American Association of Pediatrics or AAP and honey for toddler, they'll tell you the age for that.
Gotcha.
Other things that I think will be effective are just keeping yourself hydrated. If you don't feel like eating and you don't feel like drinking, force yourself to eat and drink so that your body doesn't become dehydrated, because, having a respiratory infection plus dehydration, that can be really bad. Those are the main things I would suggest. Anything that you have that will treat the symptoms.
Gotcha. I'm usually talking about business stuff here, and we were talking, Roundup, I have to bring them in. We were talking about multiple streams of income. I want to still know your opinion on that too, Doc, I know you're talking about health and all this stuff, but I feel like I'm honestly a good financial guy also, our pre-conversation. Mm-hmm. What's your opinion on that?
My opinion on what?
I'm saying regarding the necessity of multiple streams of income.
Oh, I think that's imperative. I think that would make the financial stress of what we're dealing with now a lot less burdensome. Yeah. So if you have, for example, let me think of something. Say for example, you have so in addition to your 9 to 5, you also own a corner store. You own a corner convenience store.
Gotcha.
And you have somebody else run that for you. Well, in the midst of all that, when people need to run to the store to get Tylenol, they may not want to go to a CVS that's going to be loaded with people. They may want to go to the small convenience store where there's only 2 or 3 people. Mm-hmm. That extra source of income may be able to buffer you if your 9 to 5 job, lays you off or reduces your hours or puts you on unpaid leave.
Roundup, we didn't talk about it, but the doctor actually owns real estate too. I don't want to blow him up, but this man here is not just a doctor. He is a finances. He's on his money. We're going to bring you back when we talk about real estate another day. Is that cool?
I love that. I can talk about that more than medicine.
I love it. A doctor that's in the real estate. I mean, I feel like, where have you been? It's going to be exciting to see what the future holds for us, my brother. Roundup, thanks for joining us. Get your questions in from Dr. Cobb's going to be answering questions about the virus, what you should do, how you should do things, what you need to do for the future. And don't forget, I'm also giving you half off, Roundup, half off of all my training. And throughout this week, I'm going to be having my friends on my channel that's going to be giving you some serious discounts on all their training too. I'm calling in all the favors, Roundup, all the people that I've met, all the real estate gurus, to give to you discounts on all their real estate trainings. So make sure you keep coming. Hit that bell and subscribe so you know when I'm going to bring them on. Smooth Jazz wants to know when they retired. Hey, you retired in October after 43 years of healthcare. Wow. Thank you for your service on that.
Thank you.
I know the difference between contact, droplet, and airborne precautions, but a lot of viewers don't, like me. I have no idea. Could you break that down a little bit, Dr. Cobb?
Yeah, so contact precautions, these are things that you touch, okay? So if someone has an infected wound, you want to protect yourself. You want to have contact precautions such as gloves, okay, maybe a face shield, something that physically protects you from a gross material, things that you can actually see from touching you. Okay. Gotcha. Droplet and airborne precaution, these are things how you can get infected without even touching something. So if you're at 1 foot away from someone or you're 2 feet away from someone and they're spewing viral particles in the air, you want to have some form of droplet or airborne precaution that'll block it from getting into your sinuses or getting into your
N95 mask.
It's an N95 mask. Exactly. Okay. So it's really, I think of it as two forms, either something that's going to protect you from touching it. Okay. And then something that's going to protect you from the things that you can't actually see. And really, the best way would be to protect yourself across all fronts. Like when you see people on TV wearing the full gowns, the gown is really the contact precaution. Okay, so that different forms of infectious particles don't get on you, or things that you touch don't get on you. But also, you don't want to be able to breathe those things into your eyes, into your nose, into your mouth as well. And that's where the droplet and the airborne precautions come on, which are the masks, the face shields that we see. Other people have some form of like respirators, homemade respirators, where they've used like a mask or a obstructive sleep apnea, CPAP or BiPAP mask that they put a filter on, things like that.
Gotcha. Thanks for that one. It's counterproductive using the same mask for weeks at a time. I've seen painters and contractors use the same. These dudes have masks coming in, falling apart.
I know. And it's sad because we don't have enough masks to go around. In some places, these are the recommendations that they're making, to use the mask over and over again.
Wow. I didn't know that. Will.i.am, his wife is a RT at Riverside, and they gave her one N95 mask to reuse over and over. Is that wise?
No. So also with the N95, these things have. What'd you say?
What is an RT?
Respiratory therapist.
Okay. What is that?
So respiratory therapists, they're healthcare workers in the hospital that manage ventilators for patients in critical settings. So say there's a patient in the intensive care unit that's on a ventilator, they connect the patient to the breathing circuit, and they suction the patient. They help manage the patient's pulmonary physiology. Gotcha. With the medical care team. And they have other things they do. They apply BiPAP and CPAP masks, basically any form of respiratory support that patients may need in the hospital. They do it outside of the operating room.
Gotcha. That's terrible. Will.i.am, is there a way, I guess he says, is there a way to make your own mask out of a furnace filter N95 material?
Wow. So, if that's the best that you have, my only thing with a furnace filter, I don't think it's going to filter small particles, And the reason I say that is because your furnace filter has to be small enough to allow air to pass through, so you don't burn out the motor in your furnace. These masks, these N95 masks, are designed to be really, really small, or the particles to get through this should be really, really small, so it can filter out a lot of the material. There's videos on YouTube of people making their own mask and jerry-rigging their own masks out of all kind of things.
Yeah.
So it's, it's scary. It's scary to think about, but if that's the best you have, you have to do the best you can.
Be Express, is SARS-CoV-2 the patent virus and COVID-19 the disease it causes?
Is SARS-CoV-2 the patent virus and COVID-19 the disease it causes? I'm not sure. By SARS is just a generic term for saying, I forget exactly what it stands for. I think it's, I know the RS is respiratory syndrome. It's something, maybe superimposed acute respiratory syndrome or something. It's basically just saying it's a generic term for saying that someone has a respiratory syndrome or respiratory disease.
Severe acute.
Okay. Severe acute respiratory syndrome, which is just a generic form. You can have severe acute respiratory syndrome with pneumonia, with the flu, with the coronavirus. It's a generic form. Just like saying someone has chronic obstructive pulmonary disease, or COPD, which can be due to many different causes.
Mm-hmm. Parents. Go ahead. I'm sorry. Did you want to stay there?
I forgot what I was going to say. I was going to say something else, but I forgot.
About SARS, I guess he was asking, is that the patent virus and COVID, the disease?
Oh, yeah. And the COVID-19. So the coronavirus is not new. The coronavirus has been around for a long time. Oh yeah, the coronavirus has been around for years. This is a different This is a different strain that we haven't seen before. This strain is extremely virulent, and we haven't seen this strain before. So just like the flu. So the flu, there's many different strains of the flu. The swine flu was one strain. I think that was H5N1 maybe. And then we had the avian flu, the bird flu. That was H2N3. And, the flu, it constantly mutates. The letters just designate which actual virus it is. So, depending on whatever the numbers are, it just tells you. So we've had the coronavirus 229E before. So if you look on the back of all your Lysol and your Clorox wipes, those wipes will kill the coronavirus 229E, but they do not say the coronavirus 19 because this is new and they haven't figured out how to put the stuff inside of these Clorox and these Lysol wipes that will kill this new virus because it's still new. I would suspect probably in the next couple of years, they'll probably have something that'll kill this virus.
So you're telling me this is just a new version of it's just getting stronger.
It's just a different. It's a different form. It's a different form of the coronavirus.
Okay.
Matter of fact, I'm gonna get my Lysol wipes to show you. Just so you can see exactly.
Round Up family, thank you for joining us. I'm with Dr. Benjamin Cobb. He's in the Philadelphia area, bringing you the experts so you can ask the questions. What do you need to do? I don't know what to do. I have no idea. I don't watch the news. Now I have to watch a little bit. I have no idea what. So I want you to ask the questions of the expert and use the coupon code HOPE Roundup. You can get 50% off of all my training with the coupon code HOPE. Just head on over to Chris Haskins to check out my training. Go ahead, Doc.
So these are the ones that I use. My family, we use these to wipe things down. Like if someone has a GI bug or a GI illness, if the kids are vomiting, if someone has diarrhea, or just to disinfect things around the house, they're really the same as the Lysol wipes. But if you turn and you look on the back.
I had no idea. I'm going to zoom in on you a little bit.
Where is it? Oh, here we go. So if you zoom in on the back, you'll see there right here, it says it kills the human coronavirus. Okay.
Unbelievable.
Generic virus. This is not the 19. This is the 229E that we've seen before.
So that won't kill the one that's out now, Doc?
Maybe. It hasn't been tested. We don't know. It hasn't been tested. It's too new.
Wow.
This human coronavirus just came out. This was manufactured, I don't know, maybe 6
months. I don't know, a year.
I don't know, a year ago, 6 months ago. It may kill it, but it hasn't been tested. We don't know.
That's deep. This is deep. You really opened my mind up to stuff. Think about this stuff. Paris, hey, Paris, Dr. Cobb, should young students in their final year of medical school, nursing, or residency be put out there in the field or be ready to help if necessary? Should they possibly graduate early? Good question.
That's an excellent question. Essentially, my wife and I, we were just talking about that yesterday. Students in their final years of training are being deprived of the necessary training, and no one really knows what's going to happen in terms of their graduation. So you can imagine, you've gone through your college or your nursing school, your medical school, dental school, PA school, NP school, and you're in your final semester, and now they just cancel your classes. And you have a job lined up that you're going to be starting in the summer, but you can't start your job because you haven't technically graduated because they had to shut the school down. And some executive action is going to have to come forward from some governing licensing body to say that we're going to grant these students that are graduating the ability to go out and practice if we need providers rapidly.
Yeah.
If people get really sick to the point where we need more nurses and more physicians and more healthcare providers to take care of patients, but the people have been out of school for the last 3 months and haven't finished their technical credits to graduate, somebody's going to have to step in and say, let's give them preliminary, certification or privileges to practice.
Yeah.
The problem is, until you graduate, you can't even apply for a state license at the level to practice.
Good gracious, this is nasty.
So, I think they should. I think they should. If you've been in good standing through your training,
Yes,
and
man.
you're competent, then maybe there's a certain percentage of people that we should say, you know what, let's just get you out here and get you helping. It'd be better than doing nothing.
That's a tough call right there, brother. I mean, you got to have some type of I guess, protocol for people around the country. I mean, you can't do some for some, but don't do for others. I would think that there has to someone or some government would set a protocol for that.
Mhm.
That's a good question, Paris. Wow, it's going to have to get addressed. School's done, right? I mean, I'm presuming that since Virginia shut down. I mean, are you thinking all schools are done for the rest of the year?
It's hard to say.
Up there? Are they?
It's hard to say. My sister's a teacher in Virginia.
Okay,
and I asked her. She said that they're going back maybe mid-April, but then when they come back mid-April, they have a week of spring break.
Oh, the governor, he just came on 5 minutes before we went live. The governor was on TV canceling schools for the rest of the year, Doc.
In Virginia?
Yes.
Wow.
It's over.
Wow. So that's it.
That's over. Yeah.
That just came out today?
I was watching it before we logged on. Yeah. This is happening right now, brother.
That's what she was saying. She said it doesn't make sense to finish. You come back mid-April, have a week of spring break, and then you're back in school for 2 weeks and then school's done. She said it didn't make sense. So I can understand it. That's tough. That's really tough, because then when do the children make it up?
I would think they could go to school during the summer. I'm not mad at that, but I mean, all the teachers and salaries and people working at lunch lines, the cafeteria workers. Okay, Be Express. Have more people died from the flu than COVID-19 this year or this season, Doc? Do you know? I don't know.
So I don't know that off the top of my head, but if I had to guess, I would say yes, more people have died from the flu. The reason that more people have died from the flu is because more people get the flu. Okay, so people weren't really starting to get the coronavirus in this country till maybe 6-8 weeks ago, where people have been getting the flu, probably way back as early as October.
Yeah.
The problem with I think the reason why people are really nervous people are scared about this coronavirus as opposed to the flu. If you take 1,000 people in this country, okay, they get the flu, only one is going to die. Okay. The chance of dying if you get the flu is less than 1%. It's about 0.1%. And these percentages may be off a little bit, but you at least get the point. If 1,000 people get the coronavirus in this country, okay, it's somewhere around 6%. So 1,000 people get the flu, one person dies. 1,000 people get the coronavirus, somewhere between 60 and 90 people are dying.
Oh,
higher mortality rate. So while more people get the flu in general, less people die from it.
Gotcha.
Okay? Probably because they have a vaccine. Okay. We have Medicaid. If you get flu-like symptoms and you come to the hospital, we can order you Tamiflu within the first couple days, and you're probably going to be okay. See, we don't really have anything to treat this coronavirus that we know is tried and true and that it works.
Gotcha. As you said earlier, I guess you guys are just throwing whatever you have at it.
We're throwing whatever we have at it. So I would say from a number standpoint, sure, more people are probably dying from the regular flu virus than they are the coronavirus, but also more people are getting the flu that are not dying as opposed to people that are getting the coronavirus and are dying.
Crystal Gross says she's going to take a look at Instacart. Thank you for that one. Yeah, that's a good one right there, bro.
Yeah, so the Instacart, it's not completely foolproof. The people still have to touch the bags. So what I reckon, I'll tell you what we do. People, maybe a little overly cautious, but the coronavirus, my wife, she looked it up. She said the coronavirus can last on paper things for 48 hours. We elect to do the paper bags, and we leave the bags in our garage for the first 48 hours. So if there is coronavirus on it, it goes away. I have hospital.
Could you say that again? I'm trying to get a visual of what you're doing here because I don't understand.
I pull up to the grocery store. I hit the button. The trunk opens up. They put the groceries in the trunk. I come home. I take the bags out of the trunk. I put the bags in the garage. Okay. The bags stay in the garage because the coronavirus can last on paper bags for up to 48 hours.
Oh, really?
So the bags stay in the garage. I don't take them in the house right away. They stay in the garage for 48 hours. Okay. The things that are frozen are in a separate bag, and I wipe those things down with wipes, and they go in the deep freezer or they go in my refrigerator.
That's smart.
And granted, I mean, is it foolproof? Probably not, but it's the best we can do. We're just, everybody's kind of making it up and trying to figure out what to do best. But there's a website. If you go on the CDC, there's a website on the CDC that says how long the coronavirus can last on different things: stainless steel, paper, aluminum, plastic, clothing, wood, all these surfaces. So it'll at least be able to help guide you, think about when you're touching things and if it possibly can be there.
I see Jamal is talking about part of the elite's plans. Do you have any thoughts on this thing being some type of conspiracy to generate government spending and conspiracy of the like?
You're
right there in the front line dealing with this stuff.
I definitely think it's possible. I can't say that it is, but I wouldn't say that it's not possible. I don't know if that's because, I've been home the last couple of days watching a lot of TV and all the stuff that's on Hollywood. It's like some B613 stuff but it's definitely possible. Could I see that, some of the 200 most wealthiest people from the world and all these different countries purposely release this to bankrupt every country's economy and individual stock market to then come in and profit and buy things back at low premiums? Possible. It's not far-fetched.
Wow.
I think it was very suspect that there were some people in our Congress that sold off a lot of their positions. One lady sold off, I think, 1.3 million before they released how serious the coronavirus was here. They're looking into her now.
Good.
You heard about that?
In passing.
There's some politicians that before they released all the material about just how, problematic this virus was, they sold off a lot of their shares and their stocks in other companies.
Insider trading. Well, it's always an inside, man. You know that. It's always. So be expressed. Are there different types of coronaviruses?
Yeah. So like I said, this one is the 19. This is the 19. Before we've seen coronavirus 229E, which, like I said, all your household wipes, they'll cover that. And but there's many types of coronaviruses, just like there's many types of flus. When we say coronavirus, all we're really saying, coronavirus would be similar to saying Honda. There's many different types of Honda.
Gotcha.
If you say influenza, it's like saying Ford. There's many different types of Ford. Okay. If you say respiratory illness, that's like saying automobile. There's many different types of automobiles. It comes in all different shapes, sizes, and colors.
Wow.
So when we say coronavirus, we're talking about a specific virus that has many different mutations and can affect, things differently.
Round up, get your questions in for Dr. Cobb to answer on the coronavirus, and any health questions you got here is to get your fears and your unknowns answered right now. Wealth and wellness. Would breathing exercises do any good? They improve lung capacity, which in turn could improve lung function.
I would say depending on where you are in your illness. Okay, if you're in the hospital and you're on a ventilator, we try to limit the amount of stretch that the lungs see, because every time you stretch the lungs, you cause more inflammation. Same concept. You cut your arm and you have a scab on it. Okay, if that scab is trying to heal and you continue to stretch that scab, you keep stretching it open, it's not going to heal. It's going to keep bleeding. Okay, it needs to contract and come together. Okay, and that's why you go to the hospital. They put stitches in it. The stitches are to close it and try to keep it closed to minimize the stretching so that it can heal.
Gotcha.
So the same thing that happens with these breathing exercises. If you have your lungs are chronically inflamed and they're damaged on the inside, all those breathing exercises that are constantly stretching the lung tissue on the inside could be problematic. Early on, it's really hard to say. Definitely if you're deep breathing, the more deep breathing you do, the more viral particles you're spewing out to the outside environment.
Gracious. Wealth and wellness. Sorry about that. Crystal Gross, how can people keep from panicking if they are experiencing symptoms that may be just a flu or a cold symptoms? That's a big one. When I came back from Dallas, Doc, I mean, my head was spinning. I could barely breathe. I'm like, nothing was wrong with me though. I'm just paranoid.
I think the biggest thing to prevent from panicking is to, I mean, I really don't know. I think what we all have to do is to take a step back and realize that we're all the masters of our own fate, using good hand hygiene, maintaining 6 feet distance from people, social distancing, trying to minimize the places that you can go. I think by doing all those things, that can help keep us from panicking. If you do have other cold symptoms, I think it's worthwhile being checked out and evaluated to see if you have the coronavirus. Because the reason I say this is a couple reasons. One, it's free. They're not charging people to do it.
Yeah, that's a question. How much the test works? Go ahead with that.
Oh, the test is free. The test is free. Okay. Two, the other reason why I say that is because if you do have it, like I alluded to earlier, it gives you more information to know what you should do. Do you want to quarantine because you live with your mother? Do you want to remove yourself or place yourself in some other location? More information. It gives you better information. We shouldn't just chalk this up and say, oh, I just have a run-of-the-mill community, head cold and I'm going to treat it. You probably want to know what you have so that you can decide how you're going to live, the next couple weeks.
Gotcha. TB Williams. Hey, good to see you still doing well too. Good to see you, TB. B Express. How reliable are the tests to test the specific SARS-CoV-2 virus?
So the rapid test, we don't know. The one that just came out either this morning or yesterday, we don't know about that one. The one that's the 45-minute test. The previous test, there have been some problems with it. It's giving these false positives, okay? Meaning that it's telling people that they either have the disease and they really don't, or it's telling some people that they don't have it and they really do, okay? So there have been some false results with it. The reality of it, that's really with any test that we do in the medical community. We always have to go back to the patient and say, does this test make sense for the patient? You can't tell me that the patient has, rip-roaring lung disease and the guy's running up and down the basketball court playing basketball. Mm-hmm. I think you really have to say, this person has the symptoms, they're in a high-risk population, they're coughing, they have fever, their test is positive, they probably have it.
TB Williams, thoughts on the herd method like the Netherlands and UK. Also heard Italy no longer giving elders 60 and up extended care. Wow.
Yeah, I don't know about that. I don't know. What's the herd method?
I'm not sure. I don't know. Well, I guess we'll have to.
I've never heard of it. I have to do some research on that. Thanks for bringing that up.
False positives. You just talked about that. That'd be crazy. You're going to get a test. They say you got it and you really don't. That would be.
Yeah, I know. And that's why, like I said, that's why we have to go back. The test is telling me that you have it, but you have no symptoms. Then you have to make the decision of what's really the harm in isolating yourself for 7 to 14 days. Alexis. Okay.
Go ahead. Oh, yeah. Oh, no. Somebody's saying they several people that. So you mentioned that earlier about the elective surgeries. I feel bad for people with back pain. I got my back surgery. I could have lived, but it's painful. My allergies are. I'm dying. This pollen is killing me, Doc. Dragon. If you fake the virus, don't get you to run out of food. Who's securing the information from the DNA collected from the drive-through tests? You think they're collecting some type of information from people too?
I don't know about that. I presume since it's a public health concern, they're probably reporting the information to the local state health authorities. but I don't know who gets to have access to it. I would presume probably the CDC will have samples of DNA that they can then use to try to make a vaccine for it in the future. But I'm not sure. I'm not sure about that. I'd have to look into that.
Dragon, this is what I'm all the time. Dragon should go to the hospital, or should they explore an alternate I guess birthing facility? I mean, I guess birth at home, or I don't even know what options it would be.
Yeah, I mean, I think it's case by case. You know, if you're a healthy woman that doesn't have any medical problems, okay, and you want to do a home birth, and you feel comfortable doing a home birth, it may be prudent to have a midwife and a doula come and allow you to deliver at home, and have a contingency plan that if the baby needs to be resuscitated, the midwife or the doula can do that. And then if you need to emergently go to the hospital, that someone is there on standby that can emergently rush you to the hospital.
Yeah.
Yeah.
About that. Joel, is there a vaccine ready for this?
As far as we know, there's not a vaccine ready. You know, vaccines take a long time to develop. Okay. And then you have to do research on the virus. Then you have to test the virus, and usually we'll test it in chicken eggs. Okay. Then you have to test it in an animal vector. Okay. So you give the virus to a sheep, make sure the sheep doesn't die, make sure the sheep doesn't start having seizures, make sure the virus doesn't give the sheep a heart attack, make sure it doesn't make all the hair fall off, make sure it doesn't further depress the immune system. You got to watch the sheep 45 days, 60 days, 90 days to see how the sheep's going to, you can't just give it the vaccine in the first day and see if the sheep's okay. And then after that, you go back and you retweak it. I say all this to say it could take a year before the vaccine is even ready to come out. They're not just going to come out with a vaccine and start giving it to people, and people start dropping dead because the vaccine is not, the kinks haven't been worked out of the vaccine. So they're going to really have to test it in animals and make sure that the animals are healthy, safe, and that it's actually preventing the virus before releasing it to the public. So it could easily take a year before we see a vaccine.
Good question, Drew. Kwame, what are the protocols and safety procedures? I'm sorry, Doc. It's 4:24. I don't want to. How's your time, brother? I don't want to hold you.
No, it's great. It's great.
Thank you. Thank you so much, brother. Thank you. Now, get your questions in, round up for the doc here. What are the protocols and safety procedures for maternity wards? Are they more stringent? Yes, in terms of safety and staff for expecting mothers like us.
Yeah, so, hospitals have been limiting the number of family and friends that can be a part of the birth and in the birthing suite.
Yep.
Providers are recommended to wear masks. Some places are even recommending that the women that are laboring wear masks. Imagine when you're laboring and you're in a lot of pain, you're doing a lot of deep breathing. You can be blowing viral particle all through the room and through the hospital. So they're making recommendations for women to put the masks on. The problem with putting the masks on when you're laboring, you can't take a deep breath because you're restricted. Mm-hmm. So that's causing some anxiety and some problems for women that are trying to deliver. There are more stringent protocols that we've now put in place. Some hospitals use nitrous oxide, which is our laughing gas that you receive at the dental office. So you hold a mask over your face and you huff it. It gives you some analgesia, it gives you some euphoria, and it gives you anxiolytics. It takes the anxiety away from delivering birth. And then if you get too much, you doze off, your hand falls down, you blow off the gas, you wake up, you can put it back on. The problem with this is that, again, it's allowing viral particles to enter into the environment by doing these practices. So, we're trying to work with the Society of Obstetric Anesthesiology and Perinatology, which is really the division of the American Society of Anesthesiology that takes care of our maternity, that's responsible for putting out recommendations for our maternity wards. The problem is we just got to get this information out and disseminate it to all the hospitals.
Wow. I know we got a call yesterday that said they were minimizing the staff that was at the hospital, doc. They said there was only going to be one doctor on call. So we got to make sure that our baby comes between 9 and 5. I put that request in. So Hopefully he'll come between 9 and 5. Somebody says you're a good guy. I think so too. Mrs. VSN. They're glad you addressed the paper and plastic goods. I had no idea about that either.
Thank you.
This thing is. Great example with the Ford on the automobiles. I had no idea about that either. Somebody else said, Rosanna, good example with that. Thanks for breaking that down.
Thank you.
TB Williams, how would you advise people managing their anxiety? Fear. Same thing my wife. That's the exact same thing my wife was asking you because he's frightened, but good question. Go.
If you take medication for anxiety, I think you should continue taking it. If there's a provider, a mental health provider or a primary care provider that's prescribing it, talk to them about maybe even giving you something, a short course of benzodiazepines, or even increasing your current medication to help control your anxiety if you have anxiety and fear at baseline. Other things you can do are to try to minimize the people around you that are bringing negativity. If there's someone bringing negativity or someone that's not respecting this coronavirus and, not practicing social distancing, not practicing normal hand hygiene, stay away from those people. You can try your best to educate them, but if they're going to ultimately be the downfall of you or to bring additional anxiety and fear into your life because of their practices, you have to eliminate them.
Good idea. Get rid of them. Elisa wants to know, is there a way to have a hand sanitizer recipe? Or maybe like a home recipe or something? Doc?
Yeah, I think if you use 70% isopropyl alcohol, that should be good enough. I mean, again, we haven't tested this against the coronavirus 19, but, generally the 70% isopropyl alcohol should kill most bacteria and viruses. I don't know a way to make it thicker so it has that gel consistency because it's going to come out the bottle. But what you could do is put a spray nozzle on it, get a bottle and put the 70% in a spray bottle, and then you can spray it on your hands or spray it on things and rub your hands together prior to washing them.
Nice. WL Investments, she's hearing that people don't have to pay their rent or mortgages. Does that mean people will get a month for free? Or can I get away without charging them late fees?
No. Nothing is free. Everything comes with a cost. So, when I talked to my mortgage servicer, and what my mortgage servicer said is that they will give you hardship months, and then afterwards they'll do a re-escrow analysis, okay, and figure out how to factor in those 3 or 4 months into a new payment for you, and so they can stretch it out over a year. So your payment would probably go up after 3 or 4 months of missing payments, but they're not just going to give you that month for free. No, they borrow that money from the Federal Reserve, and they have to pay it back at their interest rate, and we have to pay them back their money at their whatever interest rate we negotiated at the term of our loans.
Williams, TB was saying, I think we were talking about the herd method when they let everyone to be together. Some will live and some will die, but it will build immunity over time. I'd never heard of that one. Remember earlier she was talking about the herd method?
Yeah, that's interesting. That's really interesting. I don't think America's there yet. We're out of all the countries in the world, we spend the most on healthcare. And I don't think we're at that point of letting people die.
Wow. At least they're not telling us.
At least exactly, they're not telling you.
I'm just being real. JM, is zinc 10 milligrams a day good for this? I have no idea.
For treating the coronavirus, I would probably say no. Generally, vitamins are not recommended to take, particularly for most Americans.
Really?
Oh yeah, absolutely. Yeah, certain vitamins have been linked to increased risk of colon cancer and things like that. The reason I say this is because a typical American diet gets all of the necessary vitamins and minerals just from their diet.
Okay? So you said the typical American diet is what, eating? I don't know.
Even if you eat, if you eat fast food every day and every now and then you eat a salad, you probably have all the vitamins and minerals that you need to function,
I didn't know that.
Taking additional vitamins and minerals are generally for people that do not have a balanced diet. Okay. So if you're living in, a rural place in Central America and all you're eating is just rice because that's all your family can afford, then it's important to have other forms of amino acids because you're not getting daily protein. Okay.
Gotcha.
But if you're even if you're eating cheeseburgers all day, you're getting dairy from the cheese, you're getting protein from the beef, you're getting carbs from the burger, So generally you should have all of the necessary vitamins and minerals that you need to function on a daily basis.
Gotcha. B Express, thanks for answering the questions with professionalism. Yeah.
Thank you guys for listening.
Paris, a minister, talking to me. He's got 2 properties purchased. He has to lease option them out with the tenant buyer. When should I start discounting or helping my tenant buyers for the rents? That's a good one to think about. I don't know, Doc. I have no idea. I'm the real estate guru, and I don't even know yet.
I don't know. I think it's up to your financial situation. You have to. I think you have to think: what's most important? Is it most important keeping your current tenants because they're good tenants? They're just in a period of hardship, or do you get rid of them and try to get someone else in a period of turmoil and chaos? It's you may not be you. That's a hard question. That's tough. That's tough.
That's a tough one right there. Because some people are going to abuse it. Some people really need it. How in the hell do you? When one of my mentors in New York, he has 300 doors, and he says he's going to make his tenants verify the hardship. That's all, with the income statement.
Right.
That's a
because
rough
if you
one,
put them out, you go through the eviction process, you put them out. Now
even that's put back though. Now the eviction process is even longer, Doc.
I don't even know if you can put them out because at least in Pennsylvania, you got to go to court to evict somebody, but the court is there, so you can't even evict them. So I guess you have no option. You just hope they can pay, get whatever you can from them.
Yeah.
Kidnap their child, hold child ransom. I don't know.
Kwame, will breast milk give a newborn an extra defense? Should a newborn be isolated from other siblings? Good question.
I wouldn't say the newborn should be isolated from other siblings, because if the mother or the father is not going to be isolated from those siblings, the parent can still give it to the newborn. Theoretically, breast milk should give the newborn some extra defense, especially if the mother has been exposed to some form of the coronavirus and has built up antibodies against it. Generally, I would say that the breast milk is probably better, because if the mother has gotten her flu shot, then the mother has antibodies that she can pass on to the baby to prevent the baby from getting the flu. The mother has other antibodies and things that the mother's been exposed to prevent the baby from getting those illnesses. And something that we recently learned about breast milk that we've never known before is that the content of the breast milk actually changes depending on what the baby is exposed to.
Wow.
So outside of the nipple on the breast, there's these ducts that take in saliva from the baby. Okay, because when the baby is first born, the baby's immune system is very weakened and depressed. So there's these on the outside of the nipple that take in saliva from the baby that expose the mother to what the baby has. So now the baby is giving its bacteria and viruses to the mother. The mother then builds up those antibodies and resecretes it back into the breast milk to give to the baby.
Wow.
Isn't that amazing? Isn't that incredible?
That's incredible.
The man upstairs really knew what he was doing. It's crazy to think about that.
The perfect design, man. This is wow.
Design. So I would say that definitely by breastfeeding the baby, it'll probably give the baby some form of additional coverage of whatever's floating around out there. Very good question. Very good question.
Jamon, do you think the United States will force mandatory vaccinations for coronavirus like they did in Denmark? We've got some other mandatory vaccinations that I want to talk to you about at another time too. Your beliefs on that, but not today.
I don't know. I really don't know. I don't know about that. Denmark and Sweden and Norway and Finland, all those Scandinavian countries, they have a very homogenous population where the gene pool is very consistent. Now,
what happened in Denmark for us that do not have a clue of what that is?
So it sounds like what he's referring to is that they forced mandatory vaccination in Denmark for people. I'm not familiar with exactly how they did it.
Gotcha.
But I know that, those countries that have a homogeneous population, it's easier because the gene pool is very similar. America is a big melting pot. Blacks, Hispanics, Asians, Africans, Indians, Eastern European, Western European. It's so much different genetic variability within our population. It's hard to say, how you can force something on to different people. You can make the argument that some of these other countries that have a homogeneous population, most of the people think the same because they are all the same.
Gotcha.
If this country were mostly Hispanic, a lot of the differences in thought process that we have in this country would probably go away because Hispanics generally share some of the same societal culture and religious beliefs, and they're going to have some of the same practices and ways of living that we don't see here in America.
Dr. Benjamin Cobb, thank you so much for hanging out with us today in the Philadelphia area. You're seeing a lot of stuff up there. Final thoughts on how we can survive these next few weeks and get out of this thing healthy for the coronavirus, my friend.
I think people should, particularly people of color, should do what we've done for the last 700 years. We made it through 400 years of slavery. We're going to make it through this. The same things we did during those periods, those 400 years of slavery and the 300 years that came after those 400 years of slavery, I think we need to keep doing those things. There's your community. Call your pastor up. Pray on the phone with your pastor if that's something that really resonates well with your soul. Stay connected to friends and family members. We really need to pull together as people. We are not going to beat this coronavirus as individuals. We are not going to beat it as communities, as cities, as churches, as states. We have to beat it as a world. Everybody has to pitch in and do their part because we can eradicate the coronavirus in the United States. And all it takes is one flight from Beijing to JFK and boom, we got it again.
Wow.
This is not a state or local problem. This is a worldwide problem that we all have to pull together and address.
Wow.
So I think people need to, focus on staying strong, touching base with your community leaders, your religious leaders, praying with family, cherishing every moment because tomorrow is not guaranteed to none of us, even for the healthiest of people.
You're right.
And lastly, I think that we also need to, go back to some of those things I said in the beginning is really preparing for the worst. Redefining what our household budget looks like, cutting out the non-essential things so that we have funds in case things really, really get hectic. If we go on a food shortage and people cannot get food easily and the price of food goes up,
we're in trouble, man.
We use this we head into another recession and the cost and value of the American dollar goes down, okay, and we can't borrow money as easily. What is that going to look like for us? Nobody knows. We haven't lived through this. Most of us haven't lived through this. The worst that we've seen was 2008. But 2008, we didn't have a coronavirus. In 2009, we had the bad flu, but it wasn't as bad as this coronavirus.
Wow.
So I think we all need to be level-headed, pull together, respect one another, love one another, treat each other as if we're all family. I think we need to pull together and we need to fight this thing in numbers. Stay home as much as possible. Minimize your exposure. Wash your hands. Use good hand hygiene, contact, droplet precautions.
Mm-hmm.
And really just try to plan for tomorrow. Look at what's going on around. Probably the biggest thing that we all can do is look at what's going on around you and try to predict how the day is going to be a month from now, 2 months from now, and prepare for that today.
Yeah, I'm seeing from my viewpoint, a lot of renters are going to be out of income, and I have to remember we're interdependent, Chris. We're interdependent. You're not an island. You're not, business guy, entrepreneurs. We all try to solve. Being an entrepreneur, we're just solving problems. But this one here is like, it's not just a Chris problem or a Benjamin problem. You know, it has to kind of sink in my head. Take a little time.
Mm-hmm. Absolutely.
We'll round up. This has been phenomenal. Don't forget, later this week, I've got several of my clients and other coaching gurus, real estate trainers. I'm going to be asking them, requiring them to slash all their training stuff just for you so you can get trained up while you're sitting at home. Roundup. Make sure you take a second. Hit that subscribe button below, Roundup fam. Like this content if I've helped you. And let me know, what are you doing to prepare for this quarantine? What are you doing while you're at home? Put it in the chat box below with the video description. And I also want to know, what are you doing to prepare for your business downturn? Are you holding cash? Are you liquidating stock? Are you interfacing with your tenants? I would love to know what you're doing to prepare. Okay, Roundup. This is Chris Haskins, therealestateroundup.com. I'll see you soon. Thanks, Doc.
Thank you.
Okay.